Okay, I have a really good case today that I was very passionate about letting his video because it's a teenager, and it's a difficult decision to let your teenager have surgery. And not gonna lie, I've already cried this morning with these people. Yeah, you missed that, but I'm glad you missed it. Okay, let's go take a look. Okay, here we come. Real quick, I want to bring your attention to something. We really appreciate you guys watching, but 96% of you, 96% are watching these videos regularly and you're not hitting the subscribe button. So please go do that now. When you do that, it helps us grow our community. It helps us get the word out, educate others, and in turn, just help others, okay? So hit the subscribe button and continue watching. Okay, I have a special case for you guys this morning. This is a 17-year-old patient who has been dealing with gynecomastia for far too long. He is here with his grandmother today, and his grandmother is the one that reached out to us to get him the surgery. And something that we talked about earlier that I think is pretty cool about him is that this hasn't really affected his confidence in the way that I see it in other teenagers. He had just accepted that this was his body and he owned it, and that's an awesome thing. So I know that this procedure is just gonna lift him. He's gonna have a bigger personality than he already does. If he already has a big personality, this is gonna take him to the next level. So I'm really pumped about that for him. So I'm gonna, we're obviously not using his face here, so I'm gonna pull this down. And if you'll put your arm just right there for me. Okay, so he has an interesting history in the fact that he is only 17, but he's already lost quite a bit of weight. We were saying about between 30 and 40 pounds he lost, actually after COVID. And so here he is. Obviously, first thing you see when you look at him is just this doesn't fit a 17-year-old boy's body, and he's in good shape and everything, but you've just got this gynecomastia that we're gonna take care of today. So fortunately, his skin is in good shape, so I'm hopeful that once this gland is removed, and I'm gonna grab here, it's all right here, you can see, okay? Once this gland is removed, I'm hopeful that this skin is gonna go back just like this. Good thing about his case too is it has not expanded his areola the way I see in other patients sometimes. Sometimes that gland being there forces the areola to be bigger like this, and it's stretched. And then after the surgery, it's harder for it to go back to its normal size. So his is already a good size. So even better for his result. We've talked a lot about post-op. He's excited about it. I'm really excited about it. His grandmother was telling me that they went to 3 other surgeons before coming here. She did her homework, and so that's great. But they all had talked about doing the excisional technique, which would be a scar from here across his chest. And she was smart enough to know that that wasn't the best way to treat it. And so we are gonna do this with a small incision just here at the base of the areola, and then a tiny incision in the hair-bearing area up here. And he'll heal up good. I think that he's gonna be just over the moon about this and super grateful to his grandma. So we'll get Dr. Caridi in here. We will do some markings on his chest, and then we'll get to surgery and get this taken care of for him.
Everyone says that you're doing fine with this. Is that true?
What do you mean?
That this doesn't bother you?
Yeah, it does to an extent, but it doesn't stop me from doing anything I want to do.
That's a big deal. So how did you manage to kind of get to that point where it doesn't bother you? Strength of mind?
I guess. I just kind of accepted people are going to say what they're going to say, and I can't really do anything about that, so.
Nice. I like that. So, yeah. It's like it is what it is.
Yeah, pretty much.
Don't let it get to you. Well, because we know there's plenty of people out there with gyno that seem to do really well, right? Mm-hmm. We see them at the beach. We see them wearing shirts, and they got these big old things, and it's like you could tell that they're not bothered by it, right?
Mm.
They're usually not 17 though.
Yeah, because when you think about it, gyno comes from, in your case, from puberty, and so you figure, you go to school, and that's where it starts, right? Did you have specific encounters at school where it was kind of ridiculous or stuff that hurt you? People said stuff?
I mean, yeah, people said stuff. I mean, just yesterday, I had a kid, like, do that to me, so...
Yeah, that's not cool. Well, kudos to you. But then if it doesn't bother you, why are we getting it treated?
I just don't like the way I look with it.
Okay. Do you think you're going to be... I mean, if you're telling me that you're perfectly doing well without treatment, then where are you going to go with treatment?
I think I'll just feel a lot better about myself. And, yeah, I really just think I'll feel a lot better about myself and the way that I look.
So you want to be like President of the United States and stuff now?
Oh, God, no.
Yeah, we won't get into politics.
That's
Yeah, that's cool.
But his friends know he's having this. I think
that's cool. I think there's nothing to hide. I think true friends are somebody that, you could kind of rely on to give you the boost that you need even.
Yeah, my friends have been wishing me good luck with this.
Good. That's really good. And we're happy. I mean, this case has got a little bit of history behind it because you all reached out to us, and then Lacey, my nurse, told me the story, and then we respond, all right? And we want to help too. I mean, this is what we do here. We do this all day long, and we're honored and privileged to do it. And so young people in particular mean a lot to me because we want to get you off on the right start, right? So that you don't have to kind of deal with all the nonsense. It'd be easy for me to say other people are as strong as you can to kind of cope with it. But the way I look at it, if it's something that I can do to make a nice difference and safe and reliable and consistent, I'm down with that 100%. All right, well, let's shift gears now because one of the things that we're working on in the future is what we call advanced gynecomastia, because even though I've done a lot of it and do a lot of it and write about it, we really haven't expanded educationally about it because they're more complex cases, and believe it or not, it's actually hard to get follow-up with people. They get the stuff done and they go elsewhere. So what I mean by advanced is bigger cases than usual and cases where the decision has to be made whether or not we're going to excise skin. That's everything. So the first fork in the road, the complicated fork is, okay, I have gynecomastia, okay, so we treat it, right? So the treatment for most of us is we take a left turn and we go into the non-skin removal one, and it's my typical one that you've seen probably a million times. And then to the right is the skin removal, which means that you have scars across the chest, around the nipple, and all this kind of stuff. Now, to start off with is that they're both fine. If you need to have skin removal and in the right patient, it's fine. It's not a big deal at all. But for a lot of people, they don't want the scars, and it's a more complicated surgery. There's a bigger recovery, blah, blah, blah. I think what I brought to the table, the world's table, is that I have learned that these bigger cases do better than you think. And I've only learned this through doing, right? So I do. And there are times when I'm like, man, I don't know, this person's going to be upset or whatever because they didn't get the result that they wanted, but I'm kind of thinking that skin's going to go back, and lo and behold, it's gone back, and it's like epic, right? But yeah, I don't say this to think that everyone's going to get an epic cases or everyone's going to be happy, but what I do tell you is that I do things for a reason, and the reasons are definitely results. So you've shown his chest already?
Yeah.
Okay, so put your head back. And we're not showing your face, and so what I'm going to do for you all is just to tell you what my thoughts are. So from what I understand, the family's seen other docs, and the docs told them that he needed to have skin removal, right? Okay, which is sort of what I would think based on what, like I'm a doc, I trained, I've been through this for a long period of time. They see the saggy nature here and the sort of flaccidity of the skin, and they're like, well, we got to get rid of this and all this kind of stuff. And I think, what I think? I think in his case it's just not necessary. And remember, I'm going to back out of this and tell you, listen, I can't guarantee everyone a perfect rose garden, but what I did tell everyone is that if this were my son, there's no doubt we're going to do this. 0 doubt. Why? Because I'm confident that this is the way to go. Because no matter how you look at it, we're going to get a good result. Because if the litmus test is to get rid of this, 100% gone with what I'm doing today. But to get it back so that the skin is really nice, that's a little different. You have to choose your patient wisely. You have to make sure the skin is good. And I'm going to go into that just for a minute, and then we're going to get going with the case. But what's in his favor? A, he's 17. So, by definition, he's got better skin than certainly I do, okay? And I can feel his skin here. I can actually see this skin in the pictures that he provided. He's got small areola, nipple areola complexes, and he does have ptosis. I don't get into the grading system because the grading system just has nothing to do with the price of tea in China, to be honest with you. I can tell you that my instincts are that this is going to go back just fine. So the good news is that as a young man, he's going to be more confident out there without scars than with the scars. So that's the objective. Now, it always leaves the opportunity that we can go back as a secondary procedure and remove the excess skin and make it even better. But it's not like we're trying to milk this out and like, oh, well, let's do 2 procedures. No. I mean, how many times have I done this? You ready? So that doesn't mean that everybody's happy. Well, I shouldn't say that. I think everybody's pretty darn happy. Could it be better? Oh, yeah. But they're like, dude, I mean, I have my shirt, and I look good. And is it better to have a little irregularity or an imperfection that looks perfectly natural as opposed to a scar that's like, okay, you had some surgery, right? And so the way we look at society nowadays is, to me, it's better to have a natural irregularity than like this slash and burn stuff. Now, let me always kind of check myself. It's okay to have skin removal in the right patient. It's just a disaster if you did it when it wasn't necessary, because now there's no coming back. It is what it is. So last and least, we're going to talk about the fact that I feel confident that when I'm done today, this is going to be back, this is going to be flat, and it's going to be one of them teary-eyed moments, because that's the way I feel about it. But there's things that he needs to do when he's home to make sure it stays that way. And he's on board with the whole thing. And as you all know, or if you don't know, you better know, watch my videos, read my stuff. What I recommend is usually not to waste your time, but it's something that you need to think about strongly if you want the best result. He's 17, so I don't think he's going to be drinking a whole bunch of beers and stuff when we're done and get all filled up with water and seromas and ruin everything. He's gonna be on board because he wants the best result possible. And I think what he's also going to do is help others, okay? And that's the brotherhood. The AGC brotherhood is about helping others. It's about, we don't necessarily talk about this. Oprah's no longer around to tell us about gynecomastia, let alone just pronounce it, right? And he's going to spread the word, and his friends are going to spread the word and say, hey, this is something that we have. It's not the coolest thing in the world, but it is treatable. And the results are, nowadays, very consistent and reliable if you go to people who actually do this in vast numbers. So to some degree, there's a little bit of this. We're going to cross our fingers to make sure we get exactly what we want. But I feel good about it. And the worst scenario is not the worst scenario in the world, right? And enough said, okay? So let's get underway. We'll show you how we do it.
I just want to take a moment to share that we are all having a baby.
Huh?
The baby! Look at the baby! So, Mar, oh my gosh, yeah, I can feel her. Mar's gonna have this baby any day now, and we are so excited. And we tried to get her to stay home and rest, but she wouldn't. So this is the office baby right here, and
and she's the #1 girl in this office when it comes
Yep.
comes to scrubbing and doing the
and she just keeps coming back. I told her to take the day, but she won't do it.
No.
Oh, we could feel
I
the
love
kicking
work
going.
too
Isn't
much.
that wild?
Isn't that weird?
I mean, it could happen today, ladies and gentlemen.
That's right.
Don't worry.
Any
I
moment.
can scrub in at any point. I've got her back. So I just wanted to highlight that
Stay
in
tuned.
this video because I
Yes.
think it's a special thing that we're
It
having
sure
a baby.
is. Having a baby.
Having a baby.
Mike, I kind of think about stuff like she saw they saw two other surgeons and they both said skin removal, and I didn't say skin removal, so now I'm like, geez, am I that crazy? And I realized generally, no. It's just, I wish this was more widespread in terms of the understanding of what happens.
More trust in the healing process.
Well, it just shows a lack of, this advanced gynecomastia is a big deal. You got to be good at it. I guess that's what I'm saying. You know, it's all judgment. He's got a nice, good noggin in here.
Yeah, look at that.
So that's actually to his advantage, because I kind of liken it to the proverbial, slim plastic bag that you get at the grocery stores, and then you put a bunch of cans in there and it stretches the heck out of it. But in his case, I removed that stuff in there, and his skin, whatever elasticity's left, will snap on back. And even if it's not 100%, we can work it that way by using the lipofoam and good posture and other things to make sure it goes back the way we want it. Because you got to look at it as if this skin is all going to be elevated and loose and separated, and then basically like a parachute, when it comes down to the ground, we want it to go where we want it to go. So we can help that, and that's why post-operatively it's important. And what I didn't say in his case is he did lose like 40 pounds. So that works against him. So that weight loss is always, this stuff's really stuck. Whew.
I ain't lying.
Okay.
It was only 300.
Mm-hmm.
And also, do you think that with his skin elasticity, do you think we may need tape?
Yeah, we may use tape, yeah.
Depending
So
on-
taping is something we've been getting into lately, experimenting with, I should say. So the idea of tape is just a mechanism of helping to hold the skin where we want it to be, in addition to the compression garment and the lipofoam and everything else. And so far, so good. I mean, there's some potential downsides to taping in terms of the blood supply in some cases, and so we're kind of doing what you have to do, is kind of experiment with it and work up to it, kind of thing. But so far, so good. I think I like it, and people are able to tape on their own at home, which is a good thing. All right, let's infiltrate the other side
Okay.
so I can sit around.
Okay. Audrey, can you come over here for a second?
Do-do-do-do-do-do-do.
Can you sit that down?
Oh, boy, you picked.
No, you're fine.
So
That's fast.
the concept of advanced gynecomastia means, again, making a decision on what to do. Skin removal or non-skin removal. It is the most important decision that has to be made. That's why I think, and I always remind people, all of you who are watching, that if your doctor recommends skin removal, just see another opinion. I mean, there are cases where it's pretty obvious, but you just probably want to get a few opinions, or just make sure your doctor is sort of world class at this before you take the whole hook, line, and sinker kind of thing. Which actually goes to the whole concept too of, what do I mean by world class? Well, I mean, I got to tell you, and you probably already know this, most plastic surgeons, even general surgeons and the like, they just think this is nothing. Gyno is just, just little nothing. And that's not true. There's an art to it. I mean, it's not the most complex surgery in the world, I don't think. But, took me a while to kind of get the hang of it, and I'm still getting the hang of it. So, and I've been doing it for a long time. So, why would someone who's done, 3-4 cases in their life think that they are expert or it's easy? It's not.
Then you're in the line. You need more?
I think that's good.
Okay. She's our new nurse.
So Audrey's only been here for how long? Audrey's been now?
I think 5 months now.
We've
How
had
long?
before on camera, I think.
Yeah, we might have.
I'm not sure if that
Well,
happened, so I wanted to make sure
she wants more FaceTime. She wants more video time.
Yes.
We gotta
You know?
go get social media famous.
I know.
Oh, yes.
Yeah. So let's talk about again, like what would be a tip-off that you may need skin removal, and what are the important factors in determining whether or not you may need skin removal. So a picture is worth 1,000 words. If you send me your picture, and again, I'm just referencing how I analyze stuff. You send me a picture, and I can oftentimes look at a picture, and a picture's worth 1,000 words kind of thing, because I've just done this for a long period of time. What I would look for is just a general attitude of your skin and your shape, the shape of your chest, as I can determine in a picture, right? And then the history is an important part too. So weight gain, weight loss of big magnitude makes a huge difference. So people with 100, 200 pound weight loss, or
Well, even 40. I mean,
yeah,
look at
even
this.
40 makes a big difference. You know, I mean, people can have some lax skin genetically, but it's not that common. Usually it's this weight loss fluctuation that has the most impact. And what happens is you stretch the skin, and like stretching a sweater, you just start to tear the connections of the skin, okay? And that manifests itself as stretch marks. So he has some stretch marks, but not the real super deep ones, because stretch marks is just evidence of damage, okay? It's damage. So that's something you can see in a picture, and that's telling you something,
That's a stretch mark
okay?
right there.
Yeah, you
And
can
you
see
yeah,
little
like
ones.
they're tiny on him.
Little one,
but-
yeah. Some people have really deep stretch marks. And you know, like pregnancy, like Mar over there is pregnant. She's going to try to avoid stretch marks, and she can put cocoa butter.
Oh yeah, all the kinds of oils.
Yeah,
the
she
cocoa
keep that all
butter.
oiled up, and
Oh,
you're
yeah.
doing your best.
Moisturize it.
Not sure if it's going to help, but we'll see.
I'll try.
Doesn't hurt. Yeah, moisturizer is a good thing to do. So stretch marks is a key. Sagginess is a key. You know, how saggy is the nipple areolar complex. And then ultimately, if you just have pancake, you know, shaped chest, and the nipple is way below the fold here, inframammary fold, the bottom of the chest, that's a sign that there's not much life left. But having said that, it's ultimately, I would tell you nothing. There's no substitute for experience. I guess that's what I'm saying. There's no substitute for experience. So it's easy for someone to say, I think that you need to have this treated with skin removal. I can tell you a lot of that is born from the fact that us plastic surgeons train mostly with female breast, right? And when you train with the female breast, the object is to change the shape of the breast, but also to kind of maintain a youthful, projecting, round, breast. But that's not the case for guys. We want it flat. We want it smooth and flat. You know what I mean by flat is, we want a chest, we want some shape, but you want it to be the shape of the muscle, not this, not round and full of tissue and all that kind of stuff. You know, in an ideal chest, you have a thin layer of subcutaneous fat on top of a muscle, and you'll see the shape of the muscle. That's that hockey stick, lateral border of the pectoralis major muscle, all that kind of stuff.
He also has a very interesting, because his areolas are small.
Yeah. So it's not always the case.
Yeah.
Always the case that you get big areolas. Not always. So, but as I always said, puffy nipples is synonymous with gynecomastia. It's almost just a diagnostic certainty. You got puffy nipples, you got gynecomastia for sure. But the corollary is you can have a case like him. It doesn't have puffy nipples, and he certainly has gynecomastia. So a lot of you got folks are, do I have it? And remember, I have other videos that talk about it. It's just a diagnosis of what I would just call obvious observation. Look, I mean, feel. You feel stuff. You have round little breasts. It's probably gynecomastia, you know. It certainly is, you know. So,
What kind of gland do you think he has in there?
oh, hard to know, which is one of the reasons why I'm not a big classification guy that learned in the old classification themes and like, you know, what kind of tissue is there, whether it felt a certain way or not. I can't tell. And I've only done, you know, 6,000, but you know, it's deceiving. I don't even know where gynecomastia ends or where it begins either, which is interesting. But that circle pretty much tells me the area where clearly there's something growing right there. So what I'm trying to educate everybody out there is that, you know, we know some things, we don't know others. And so where does it begin, where does it end? Grossly is right there, but actively, meaning like if I were to leave tissue, which tissue is be more likely to recur or regrow? I don't know the answer, but I would think it's probably the one right underneath the nippleareolar complex, because that's where it starts.
Like mycelium or something.
Like what?
Like a mushroom.
Yeah, it just grows. So it starts under there and it just kind of expands out circumferentially. You can tell here. So let's just talk again a little bit about options. All right, so you go to the doctor and the doctor says, well, I'm really not sure if you need skin removal, right? So the doc can just say, hey, we need to go straight to skin removal, which again is not the worst thing in the world. I mean, I do a fair amount of them and people are happy, you know? But I feel pretty confident that the people that I did it on, they needed it. I actually specialize, well, but for the most part, I actually don't remove the skin. And so what I'm studying in my practice right now is, well, what results are we getting? You know, I mean, and are these results that make people happy? Because that'll help me determine whether or not my recommendation is, you know, you need to have more skin removal.
Like no scar on your chest.
Yeah, the scar on your chest usually goes under your arms if you have fullness under there as well and lack skin, and around the nippleareolar complex as well. Once you make that scar, there's no turning back. It is what it is. So the alternative for some people would be, let's just say you didn't know, and you're like, you know, I don't know how your skin's going to do. So you can always say, hey, let's just do this standard approach, right? No skin removal, and let's see how you do. And if you do well, then life is good. And if for some reason it didn't bring you to the state of mind where you wanted to be, then you can always have a secondary skin removal. So that's always an option. Now, obviously, you know, maybe you didn't want to have 2 operations, obviously. But, you know, I have people that, and in fact, it's everyone. I tell them, look, I can't give you a guarantee that you're going to be perfectly happy with what I do. But, you know, they always have the option for a secondary procedure. So it's nice to have options, right? You can't have a skin removal procedure and then not have it. You know, once you have it, you got it. And you gotta live with that. The question I have sometimes, I say to myself anyway, is it better to have a scar on your chest with something that may be tighter in some ways than maybe an imperfect result with a crease or a fold or something like that has no scars? I don't know the answer to that. I think I personally would probably lean to, I can, you know, accept an imperfect chest, but if it looks natural, that's okay. So have a crease or a fold, or, I mean, that looks sort of natural, right? Whereas the scar is, you know, clearly man-made, right? And maybe you'd be less inclined to go to the beach if you had, you know, a big slash on your chest as opposed to nothing but a, you know, crease or a fold that seems kind of natural. So you'll have to help me to help other people to answer that question. I think my
preference.
yeah, that's a personal preference, but you know, common sense would dictate, man, if I can get to there without skin removal, that would be the way to go. If the measure is really how you look in a shirt, then this would be easy. You never have to do skin removal because you just do this and it'll be flat for sure. But you may have some skin irregularities, which, you know, may not make it so that you want to take your shirt off, right? So I don't always look at these cases. In fact, I never look at the cases. Well, how? If the answer to the question is, hey, just make me look good with a shirt, oh, well, this is easy. This procedure is easy, actually. If the measure is make me look good without a shirt, oh, no. Totally different story. Totally different story. That separates the sort of the novices from the true professionals who understand the nature of this procedure. I mean, do you really want someone to operate on you who's done a few of these? Think about it, you know. Do you want to get lucky? I guess. And it's not to say that, you know, again, it's not to say, you know, perfection's guaranteed, and certainly it's not, it can always be better, you know, if your doc goes in there and sort of contours things up so it's relatively smooth, but leaves more than you want, well, I mean, at least that keeps your options open, you know, for additional procedures. I do a lot of, obviously, secondary, tertiary procedures. So in other words, people who have already had this stuff done a lot. And they're almost in all cases I can make it better, for sure. You know, and the most common reason why I have to go back on a patient, not me personally with my patients, but with people I see from all over the world, is because there's tissue that remains. Or it wasn't really sculpted well, you know, like there's the zone system that I have is how to treat the whole chest. It's not just here. If you just treat here, then, you know, oftentimes it doesn't look good, right? So the whole idea of my zone system, which I published, is you treat the whole area because that's your chest. The whole thing is your chest. That's what you're going to show the world, not just here.
It's a balancing act.
Yeah, like everything in life. Okay, we've been engaged how long? 12 minutes. It's a good period of time. So what we're going to do in this particular case is I'll just get this out on this side, and then I'll work on the other side, and then Micah will take a breather, and then we'll come back and sort of assess the whole thing, see where we are. Now, what can I tell you about how this works? Well, we're going to know pretty much right away how he's going to do, or at least I'm going to know how he's going to do. How the skin retracts. We deliver this thing here, and we'll see how that skin goes back. And if we're lucky, it'll go back well. It's just a good way to start.
Are you going to do suction or straight at it?
I'll go straight at it.
Okay.
And the thing I can tell you too is the analysis of skin, like I keep telling you, like, well, I felt the skin and I could tell something, right? Well, it's 42 years of doing skin and doing this profession, so it just, you know, this communication between my fingertips and what's going on here and this little stuff is real, you know, and but it's very subjective, which means we're not measuring it, we're not like making a science out of it. It's just like, well, Bob just felt this area, and you know, he's sort of determined something, you know. But that's the beauty of the art of medicine. It's a lot of it is very clinical, which means it's subjective to some degree. Everyone's a little different, and people's experiences are different, and all this kind of stuff. Small incision, small areola. Are we going to be able to get this whole thing out? So think about it. This thing's out to here, and we're going to try to get it out from here. I can barely get my finger in here. Create a thin flap, because thin flaps contract more. I use my finger because it works well. It works well because gynecomastia is, in most cases, is well localized. Like I said, it's within this. I usually make a blue marker, by the way, but this one's black, so we can change it up a little bit. But you know, it's in a defined area. So I freed up the whole top side here, right? Where's it going to be stuck? Right here, obviously. Obviously, I say,
Underneath
because
the areola.
that's where it starts, right underneath the areola. So it starts right there. So believe it or not, it starts right underneath this areola. Under here, and it just spreads out. All right, so I'm on
like
top. I
that.
freed up the top side here. I'm
Yeah,
gonna
right,
I
yeah.
like that.
use my
analogy.
finger to find a hole to get on the bottom side because it is well localized. So I made a little progress here and there. And you can do this any way you want in terms of surgeons. You could, you know, use your electrosurgery device, I guess, if you want. You could use a scissor and all this kind of stuff. You know, you can dissect it any way you want. But this method that I have here works well. That's why I do it over and over again, because of all the methods. This works in my hands. You can see that his stretch marks are worse when I pull, so you get to see them. You see these stretch marks here? So that's not positive, but it's also not negative. So it's not an all or nothing. Oh, you got stretch marks, you know, therefore you can't. It's just another key to the puzzle, if you will.
In regards to the type of skin.
The decision, the decision-making process. I mean, how a surgeon has to go from examining you or maybe seeing a picture of you, whatever, and say, hey, you know, I think. You know, I always tell people I think. I don't really know. I'm not the end all of all ends. But you know, when I say I think, it's pretty strong. I think. So I'll tell you if I'm not sure. I mean, you have people that want to have skin removal, even if I wouldn't recommend it, right? Then you have people that don't want skin removal when I recommend it. It's like, you know, your skin's really not that good. I don't think it's going to do well. Oh, but let's give it a try. You know, that kind of stuff. Okay. All right, so I freed it up a bit, but not everywhere. It's stuck right up over here. I can already see where I have a rim around here of his normal chest tissue that exists after I've removed this mass, right? Because or it's sliding this way because I freed it up all over here. But so I also want to have it thin underneath the nipple areola complex. Not for two reasons. One, it'll contract more. Well, I'm not that worried about him. His already pretty darn small. But for others who I want to make a smaller areola, the thinner this is, the better. At the risk of vascularity, by the way. But I haven't really, that's not something I haven't had to worry about, because the way I do it, at least, it's not common to have any kind of compromise in terms of the blood supply. But anyway, freed it up here, all right? You're going to see, if you're going to see gland anywhere, it's going to be right underneath there. So yeah, right here, because this is where it starts. And free this up, okay? So I could, this is nice and thin, and I can flip this over and you're looking at dermis. So this is just dermis. That's not gland, not white, although I show you white. That's just dermis. That's what the dermis looks like. If we move up over here, there's some fatty on the flap as well, and underneath there is just the mass that I'm working on getting freed up, but I gotta continue to work to free it up. And we get to deliver. Oh, boy, look at that.
Baby.
Yeah, we get to deliver the baby. More meaning today than any other day.
Yeah, not about to go into labor, right?
No, water hasn't broken yet.
Still
Gonna
there.
have a YouTube moment.
She doesn't want to be the star of the show yet.
Yeah, that'd be kind of fun. Sorry, Mar needs to leave. The timer went off. Oh boy. So what I'm going to do is, I freed it up pretty good, but it's still stuck right here.
It's cool that you can see. I don't know if you can see that,
the divot.
Micah.
Yeah, so
you
see
see how
that,
it's
yeah.
already kind of gone to the side.
So we infiltrated all
Laterally.
this area, which actually blows it up too. But you can see, if you remove a mass, you're going to have a hole, right? So this is sort of the divot that you can get, because this mass is here now. It's kind of shifted. So we're going to
Move it.
try to see if we can get this out. Nah, don't help me that much.
Okay.
Mara sometimes want to help a lot, but her hands can interfere with your video here. So, and then this may be I've never had to make the incision larger out on the normal skin to get a mass out. Never. Right, Mar?
Correct. Yeah, no, we've never
So-
done that.
People, I mean, it's an option, obviously, but never had to do that. So if someone plans on doing that from the start, that's a sign that they probably haven't, well, you know, they may be different, whatever, but they probably don't have the experience that, you know, it's not necessary.
Well, there you go. Look, it's coming.
Yeah, she's delivering.
Oh yeah,
She's delivering. Woohoo!
delivering that baby.
Delivering that baby. So like I said, it's going to be stuck up here, so I'm going to flip it out from the bottom up. And by the way, you know, I haven't done any liposuction either. So, get this out of here. Boom.
Oh, there you go.
All right, that's the hard part. So that's most of it, right?
Flip it this way.
Mar loves to. Don't want that shooting around. Look at Mike is even. Mike is moving the camera.
He's like, do I want it?
Well,
Do I want a face full of land?
You can tell that it's still there.
yeah. All right. So that's a lot of it, and then it's heading up here where it was stuck, like I said. So now what I'm going to do here is just free this up a bit here. Voila. All right, so what do we got? We got thick flap up over here. We got a lot of fullness over here because this is filled with fluid, but he also had fat in this area here. And so we have this divot right here. Why do we have a divot? Is because look what we just removed, all right? It just fits perfectly right there. So this mass is right here, but this is the gynecomastia mass, and you want it removed. Here it is. You got to remove it. Or you can leave some in there if you want, but you know, we're going to show you how to do it so that you have complete removal. What kind of tissue is this? I don't know. You tell me, which is my way of saying you don't know because I don't know. It is gland in here, obviously, but this, you know, there's other stuff. Which part of this is hormonally active and potentially can recur? I don't know that either. I always say if there's a pathologist that wants to work, please let me know. Let's do some research and find out what part of this is sort of hormonally active and what part isn't. All right, so anyway, but it's out. And then under here, you're looking at his, essentially his muscle. His muscle's right there. So what I'm going to do now is the shaping part, right? So now this is the liposuction part. This is, you want to switch? You want to dance with me, Micah? So clearly, well, what I can also tell you right off the bat, his skin is going to do fine. Why? Look. Already did fine. So look at it. It went back. The nipple areolar complex already rolled up. It was over here, right? And now it's back over here. So not only is it's gone back, but it also has gone superiorly towards his head. That's a good thing, because usually the position of the nipple areolar complex is better suited higher when you have significant gynecomastia. And so the paper that I'm working on, and I love talking about papers I'm working on and then they publish, but
paper I'm working on is going to clearly show what we already know, that the nipples rotate or move superiorly and medially, so they move towards the midline as well. The bigger the chest can become, the more lateral the nipple areolar complex is. So that's exactly the opposite of what gynecomastia does, which is great news, right? So gynecomastia makes the nipple go inferiorly and laterally, and so removal, the way I do it, makes the nipple go superiorly and medially. Mother Nature. And so that's why you don't even have to reposition the nipple. I mean, how many times do I have to do that? 0. I reviewed a paper recently where they talked about, you know, doing a technique to reposition the nipple areolar complex in the gynecomastia case, and the conclusion that I came up with is it's completely not necessary, because it's not necessary. You didn't have to do anything. It would have gone where you needed it to go just naturally. But you have to think that way. So hopefully the paper will make people think that way and say, I don't have to move that. It's just going to go that way by itself. And why subject the patient to scars when it wasn't necessary? So flatten that out. And now I'm going to work laterally to reduce a lot of this fullness here. And this is the sculpting. So this is a big deal, this part here. You know, this is like, you know, it's like, oh, what's he doing now? Well, this is what's bringing it home.
Yeah.
Right?
Yeah.
Truly
Especially
bringing it home. This is like,
if you were to just take the tissue
yeah,
out.
if you just take the tissue out, then you got a hole. That was a paper
And you got fullness
40
on the
years,
side.
40 years ago, where they said the treatment was worse than the actual condition. It's because they just took out a chunka like that.
Didn't do anything else.
And they didn't do anything else because it wasn't here. Liposuction didn't come around,
Oh, really?
yeah, until the 80s, late 70s, early 80s. So that made a big difference because now you're able to sculpture the result.
How quick after it came did it become good?
Oh, it became pretty, you know, because liposuction became the most, I think even today, liposuction is the most common procedure performed.
Because the results were
Yeah, and maybe that'll go down because everyone's taking
Ozempic.
and these other drugs and stuff. So probably skin surgery is going to increase in the future because people who lose all that weight are going to want to do something about their skin, you know, excess skin. So, I guess the cat is out of the bag. Is that the expression? We already know how his skin's going to do. Look how it already did. So, we don't even have to wait until tomorrow or a month or two or whatever. I mean, I've been proven correct right now. Now, we want to get follow-up just to see how it all eventually comes out. But I dare say, if all goes well, he's not going to look much different than he will off the table today, okay? He has to go through healing permutations, which is just, you know, unpredictable to some degree. But he follows the regimen, follows the instructions, and if he's like 98% of people, he'll do just fine. So this is much better, looking good, but I still have this big kind of chunk up here, and it's so chunky that I'm thinking that
Might be mass.
I have to kind of do it with my scissors. So Mara's going to show me, and here's this like wave here, this whatever you want, what do you want to call it? Here's a ridge, yeah, ridge. So here's a ridge, and we're going to take this ridge down. I could take it down with lipo, but usually this is associated with a fair amount of fascia layer like this. I'm taking this down to sort of even it up. This also flattens it and makes it better. See, look at that. Boom. Much better. Okay.
So you can see that just laid.
That was laying
Right
right
there.
there. So that's gone. This here's a nerve. It's gone. A little bit of ridgy to ridge stirs right up over here. I could probably get in and do some lipo, but it's just tenacious. So I'm gonna contour that with this. Now, what I'm doing and making this look very easy, I hope, is not that easy. And there's a difference between someone who knows what they're doing, someone who's been there before, and maybe someone who has not. So these little things that I do, and I don't even think about them because I don't, it's just instinctual because this is how this procedure evolved. So I'm as happy as a clam. I mean, I think he's going to be happy as a clam. I think if you're watching this, you're going to be like, wow, kind of cool, right? But I'm not quite done here. There's a little bit more, just a little bit more I want to do. Knowing the end point to surgery, again, is something that you should only have to do 6,000 to kind of get a better idea of when to end. And I haven't shown you the, what do they call it, piece de resistance? The real clinker here, right? So I don't see a lot of irregularities here. I like the contour. He's tough because he is. Oftentimes people who lose weight, things are magnified. They're just definitely tougher. I like the skin retraction. I like everything. I'm going to go back a little bit over here. Get a little bit more. He gets Mondors, by the way. Nurse. Good nurse. My future nurse of the world is in the wings. Right here. I mean, Mars not going anywhere, but...
Mondors, you mean the Mondors protocol?
Yeah, Mondors protocol.
You can already tell a big difference.
Yeah.
If you're looking at this angle.
Yeah,
You can
Mike
tell
is going to get different
big
angles, but let me show you what we're going to do.
Look at that.
And this is an important thing. Now we want a layer of fat between the muscle down here and the skin up here, right? And so lo and behold, without having to leave gynecomastia tissue, we just do my suture technique. So I grab the remains of that flap that I removed there, come down here and grab this flap down here. And that's native tissue, that's his normal stuff. Hopefully without gyno, because you saw me remove the gross part. And for you exactamente people out there, I don't know, it's just stuff that's tissue that can be regrow. I don't think so, because I've only done 6,000. I've only seen like maybe 3 recurrences. Remember, if it recurs, it doesn't recur like that. It recurs just as a little nugget. I can see a little separation here. See this here? This island or edge goes to this island or edge. And we make a nice sandwich, okay? So this is where we have a beautiful layer of tissue underneath the skin, on top of the muscle, so that the results are really smooth and natural. That's what I'm looking for. Something I could be proud of. Remember, when I do my cases, it's how I would want my chest. Get a little bit of that. Get this flap here. Boom. Boom. Woo. This is an absorbable suture. These are little. This thing can create little lumps and bumps that you may feel when you're working your chest. We haven't touched a lot of other things today in this video. We're trying to stay on point, meaning we're going to stay, as hard as it is for me to wander off, we're going to stay on point. You can see I can move his nipple up here, I can move it over here, I can move it here. A little bit more challenging to keep it there, but I like this. I just think I see this right there. Right there. So I'm going to go after that.
Lipo. Can you turn
A
that
little
back
bit more
on,
lipo,
please?
just right there. And he'll work this all post-op with massage. And what you're able to do is flatten this out even better. Make it as natural and smooth as possible.
You can see that.
Yeah, show them that. So that's
It's just a little, but it's.
that's it. But
there.
it did the job. That's perfect. All right. And so you say, even, do I need tape to hold this up? I don't think so. I think he's retracted so well. He's good to go. So we're going to cut it there, and I'm going to do the other side. And then, you know what, make some room. Oh, I guess Micah has that.
Yeah,
So Micah's going to show you this video here from that camera, and you can see
the difference.
the difference. So you're going to be able to see the lateral border of his pec muscle here. He's got more of a V cut. He certainly doesn't have boobies anymore, and he's going to have a chest he can be proud of. He can live his life free of this nonsense, and that's why we do this.
About the massage.
I haven't been doing it as much as I need to, I'm not gonna lie. But I have been doing it. The handheld one is better, personally.
Like the little ball
Yeah.
thing? Okay.
Yeah, because then like you can control like the pressure or whatever.
Right.
I did use the machine one.
Yeah,
or whatever. I had to like put my hand and then the machine.
Yeah, on
so
top of
a
it.
little
Yeah.
bit, but
Yeah.
besides that, it's
I'm going
good.
to touch on here. Good. Good, good. We're getting there. It's a process. Okay, can I take your necklace off?
Yeah.
Here. It's just right there in front of me. Okay. All right. Well, good. I think it looks great. Keep massaging. Please. Keep massaging. Okay, guys, we are 30 days post-op from gynecomastia treatment for my patient. I believe I've said in the previous videos he's a teenager, so it's always very near and dear to my heart because I have a son and I feel like I would do this for my child, and I know that it's a really difficult decision to make as a parent whether or not to do this. In fact, well, his family knows because I've cried with his family over it because it's a very emotional thing for when you have a young son dealing with this. I just had a patient come in the other day and he was 15 and he was here with his parents, and they came in the room very stoic. Didn't really give me much as far as like smiling and like warm and friendly kind of feel. And I knew it was because they're nervous, right? They're very nervous, just scared of the whole situation. And the moment I said, I know this is a really difficult situation and a difficult decision to make, the mom started crying. And I was like, man, that's because that's how you feel about it. It's such a big decision and you want to do what's best for your son. And so anyways, I always try and scoop up the moms who are trying to make this decision because I feel like I can give them good guidance. And so I hope that's something that resonates in this video. I tell people, when your son is here with me and Dr. Caridi, I'm going to treat him as if he's my own, and I know Dr. Caridi will do the same. You're your family when you're here, and so you have nothing to worry about if you are trying to make that decision for your son. Bring them here, we will take care of them, and then they get to reap the benefits of a successful surgery for the rest of their lives. And they can put this behind them and it doesn't affect their confidence anymore, and it's just a very powerful thing. And I know that may sound silly to you talking about plastic surgery, but I have seen the power of this procedure and what it does for people, and it's huge. And if you ever want to call me and pick my brain about it, I'll tell you all about it, okay? So, this patient, 30 days post-op. So, something that I really want to focus on too is the process. This is all a process. This is not just overnight instant gratification. It is in some ways because you can see that the tissue is gone and you can see a smoother, flatter chest, but then the healing starts to take place. And you get things like induration, swelling, you have to roll out the scar, and that's why we spend so much time harping on it, dealing with that scar can be a process, right? So he told me before we started this video that he could do better, but I can tell he's done pretty good. His chest feels pretty smooth, but we do have a ways to go. So we're gonna show you right now. And I know with the video, you just watched the surgery, right? But this is the before, okay? And I really tried, I wanna make sure I don't go I really tried to help him manage the skin, because you can see that when we take out the gynecomastia gland, that there's gonna be some laxity there, okay? And then I'm gonna cut to another photo here that I feel like is important. Okay, this is a great one. So this is right after. And this is the taping. And I actually showed them how to do the taping at home, which I think we do have in this video, I hope. But I can't remember. It's been a minute. I can't remember if we videoed it. And this, you didn't?
Oh,
I think I took a video for y'all, didn't I? Yeah. And this is 2 weeks later. It's kind of grainy photo, but you can see that it's just overall healing taking place. He's got some bruising in there, irregularities of the skin. And that's something that will, smooth out with time. But they've done a really good job keeping me up to date on the progress, okay? So I feel like I've really had my finger on the pulse here when it comes to him and knowing what's going on and how the healing's going. So, all right, so here we are. I can tell he's been rolling too, because I feel like he's got some dry skin in here too. But you can just tell. He's overall soft. The skin's gone back really nicely. It's gonna take a little time, all right? This is just 1 month, 30 days later. I'm gonna have him keep massaging. I may do a little steroid injection in here. Don't worry, it's like the tiniest little needle. So I'll do a little bit of a steroid injection in here to get this to soften up. That helps to relax the areola. I am particular on when we do the steroid injection. You can't just do it 3 weeks later, right? So please don't call me and tell me you want a steroid injection 3 weeks after. There is a process. In fact, I may actually make him wait because it is only 30 days. That's pretty fresh. He's only been massaging for 2 weeks. Okay, so I want to see how far he can get with the massage before we have to do any injections, okay? And it's a case-by-case basis. I can tell a lot from a picture, and I can determine that way if, you are at a good place for a steroid injection, but it's definitely not a 3 week later kind of thing, okay? Over here, same kind of deal. He's a little more swollen. I can literally feel it. I don't know if you can see how much my hand goes in there because of the swelling, okay? So he's still swollen. This is a big case. We got a lot of gland out of there. So he's doing fantastic. I'm very happy with his progress and where we are with things. And I know it's just going to keep getting better and better. And the most important thing, I asked him, are you happy? And he said yes. And I think he's telling me the truth. Yeah. Good. He's happy. And that, at the end of the day, is all we care about, right? He feels good in his shirt. He came in wearing a t-shirt that was, I don't want to say tight or anything, but it's, more fitted. It wasn't super baggy. So he's just holding himself well. He comes in with his shoulders back, and that's what we're here for, right? That's the goal. And so we'll get some photos today, but I do hope to get some follow-up further down the line as well. Okay, guys, we're 3 months post-op gynecomastia treatment for this patient, and I wanted to have him come in early so that I could see how the rolling is going and just the overall massage and how scar tissue is going and all that good stuff. And I'm really glad I did. No, that's him 1 day later, I believe. That could be. We've done a lot of photo exchange here, so it could be actually later. But I just want to take you back to what we were dealing with. And you had some weight fluctuations, right?
Yeah.
Okay, so when you have the weight fluctuations, it stretches the skin. It puts a lot of tension on the skin, right? And then when you lose weight, it kind of collapses down. So the skin elasticity isn't, always wonderful, right? So we knew that going in, but I think we've really got a great early result. So we did use the tape, and in fact, I'm going to take a second and just find that picture of him with the tape. So as you can see here, we've put tape to hold up the skin so that it will heal up instead of down, right? And we've accomplished that, right? So there's no like firm creases in there. And overall, it's healed pretty good. You see a little, this is due to skin laxity though. And over time, over the next year, this is just going to get better and better and better. But I believe him when he says he does the massage and stuff, because through here, it's pretty soft. I just kind of grab across there. I don't really feel anything crazy scar tissue wise. Over here, I notice this localized kind of swelling right here. Yeah. Not uncommon, but behind here, I feel this scar, right? So today I'm going to take advantage of him being here in the office, and I'm going to inject this with Kenalog, which is just the steroid that we use that will reduce that inflammation and hopefully help speed up the healing process and get rid of that localized swelling for him. But overall, he's had a really good experience with this. That's right, isn't it? Yeah. I've kept up with his family, and because he's young and he's busy, which is great. He's gone swimming. He's got a great social life, and this has helped a lot, right? Mm-hmm. Yeah. You glad you did it?
Yeah.
Good.
I just want to go do something this summer, though.
You can. Is she telling you can't?
Well, I just haven't really thought of anything yet.
Yeah. Well, go do something. Take a road trip. Do you have a license?
I do. I don't have a car, though.
That's a problem. Got to get a car. And you can't rent a car because you're too young. That sucks. Anyways, yeah, you got many summers ahead, but it's exciting that we took care of this early in his teen years so that he can go off and enjoy all the summers of his life. So anyways, I'm really grateful to them. I know at the beginning of this video it was pretty emotional because he's so young and everything, and I'm really grateful to them that they came here and let us help out, and then also did this video for us, because that can be a difficult decision, even though it didn't ever seem to be to him. He was always like, sure, whatever. So love that. Anyways, if you have questions about teen gynecomastia and treatment, please reach out, ask questions, go to our website. Thanks for watching.